Welcome to the Varus Malunion Lab. For the next 90 minutes, you're going to conceptualize and execute the correction of a proximal femoral varus malunion. The importance of this is that we all see malunions, whether we create them ourselves or whether they're come to you from somebody else, but you're going to see them at some point in your life. And the important part is that you understand how to conceptually fix this problem and that you carry out in a careful and planned manner. So today, the exercise is a very difficult one. It's difficult to do this, and it's going to take a lot of planning. The important thing with this lab is mostly the plan. So within the next 90 minutes, you will divide it up mostly half and half. About 50% will be for the planning, and about 50% will be for the execution of the lab itself. The important thing is that you create a very good plan that it makes it easy for you subsequently to execute. You'll have to pay very close attention to this video because it's a difficult lab to do, and there are a lot of small points, so pay very close attention to it and try to plan in your mind as you go along the steps that you will have to do. Afterward, we're going to pretty much cut you loose. There will be some assistance from your table instructors, but mostly this lab will be up to you. And your success will be largely determined by yourself. It's a difficult lab, but it'll probably be your favorite one. So the idea is to correct a varus malunion of the proximal femur, and you're going to create a preoperative plan, write out a surgical tactic, and then execute your plan all within 90 minutes. At least figure 40 minutes on the planning and probably 40 minutes for the executing, and really work efficiently. And so the easy things make easy. So the tracings and that kind of thing, work really quickly through the things that are easy so that you can spend time on the things that require a little bit more thought and are a little bit more difficult. So the model that you have is a 95-degree malunion. We're just going to tell you what the numbers are right from the beginning. The normal femur is not really a normal femur, but we're going to try to reconstruct this varus malunion back to what we assume is this patient's normal, which will be 120 degrees. So on your table, you can see that you have the radiographs, the light box, there's a template, and in that template package, there is a template for the 95-degree condylar blade plate, which is the implant that you're going to use. And this is it right here. And you're going to use this for the final fixation.
Also on your sets, you'll notice that you have a plastic goniometer. This goniometer is typically used for creating your preoperative plan. It helps you for creating the angles as well as the circular portion, helping you find the center of the femoral head and then the center of the femoral neck. You also, in your set, have these small triangles, and these triangles have 40, 50, and 90-degree angles on them. If you happen to need a 90 or 40 or 50, it's perfect, but additionally, it will give you other angles, which would be the bisected angles. There's a hole in the center, and if you run a line directly through the hole in the center, that will give you the bisected angle for each of the other angles. So, for instance, the 90-degree, if bisected through the center of the hole, will give you two 45-degree angles that you can use intraoperatively. The 50-degree angle being bisected, obviously, will give you two 25-degree angles. And the 40-degree will give you two 20-degree angles that you can use. If you need measurements between these, say 23 or 38, or any other angle, you can use a sterile metal goniometer.
So you have this, the radiograph. This is the AP of your normal. You want to trace this thing out. And a lateral also of the normal, which probably is not really necessary for you to trace out. Certainly you have to trace out the abnormal, the varus malunion. And then if you want to, you can trace out the lateral on the varus malunion, but you should understand that this femur is just slightly retroverted from a normal femur. So you may or may not want to address that as part of your correction. So you put hopefully you've already working on this thing here, tracing out. You want to put your paper over the top of it and then start your tracing. And you should have something that eventually looks like this. So you're going to draw out the AP and the lateral, AP of the normal. And then the first thing you're going to do is try to figure out where the center of the femoral head is and what the axis is of the neck. And as I said, I told you the axis for this patient is 120. So you can draw in the anatomic axis for the femur on the normal and the abnormal, and then you can draw in the axis on the neck. So the axis of the neck on the abnormal patient should be 95 degrees, and on the normal patient should be 120. That's what we refer to as the CCD angle. So that's the first thing that you have to do is draw those things in. And then you can overlay these two models, and you can realign the trochanters and the center of rotations on the two ends, you can get an idea as to what the correction is that you're gonna need. And this correction right here, this angular difference right here, is basically gonna be what your correction is going to be, because you're gonna wanna realign the anatomic axis eventually. And if you overlay those two anatomic axes, one on top of the other, it kind of gives you an idea in the proximal femur of what the deformity looks like, how much shortening you have, and really where your deformity starts, you know, and how you may wanna base the wedge that you're gonna take out. So you may want to lay one on top of the other and get an idea of what this is going to look like when you're done by realigning these anatomic axes. And you should have something that starts to approximate this. So you're going to draw these axes in. You have the axis for the femoral neck, which we said this is 95 degrees here. And you need that. And then you're going to have to get an idea of what the normal axis is in the proximal segment here of the femur, because eventually this line here is going to have to match up with this anatomic axis here. So you draw these things out. Eventually you'll have this, and now you have to calculate what this wedge is going to be and where the wedge is going to go. And this is sort of the artistic portion of this, is where the wedge is going to go and how it's going to determine what the shape is of things in the final end, and also how much length you get. So what I've done here is I set this thing here to 25 degrees because I figured that this is a 25-degree correction. And I'm going to use this little spot right here to determine what my angular correction is. I'm going to put it on the side of the femur, and I can basically put this thing anywhere I want. I can take a wedge directed up or down or any direction that I want, and it's going to change based on the size of this as opposed to putting it like this. It's a bigger wedge, and I'm going to be getting much less height out of this by taking a bigger wedge like that. So where you put this thing and how it's directed is going to determine what the final shape is. One of the things you can do, and the advantage of this goniometer, is when you set this thing to 25 and you move this wedge sort of back and forth, if you look down from the center of the femoral head here and you make a measurement from here to here, this is going to tell you how much length you're getting back. So you can slide this goniometer back and forth this way and increase or decrease the size of this wedge, and it's going to give you more or less height on this side, if you understand that. And that's an important thing here, because you want to assume part of the thing is that there's a 2 centimeter leg length discrepancy in this patient, and you want to try to restore that length. So this is what I've drawn out in my particular model, and this is what the resection wedge is going to look like in my particular model. Then you want to draw out the proximal and distal segments as separate items, line up the anatomic axis, and this is what you're going to have in the end, and this is the way you want your femur to look. The nice thing about that is you can just lay the one back on top of the patient's normal and see if you've actually recreated something that looks pretty normal, and I think in this particular case we did. So go back to this image here that you have recreated. You can lay your template on the top of this thing now and draw your template in, and this is what your final construct will look like. Now the advantage of having this final construct is then you can use this to tell you where the blade is going to go. So you take your abnormal femur, you line up this section up here on the top, and this plane right here is going to tell you where your chisel is going to go. So now you know exactly where your chisel is going to go. You know what you know what your cut angles are going to be. And it's just a matter of measuring things out at this point and writing them down. So you start off first for your plan to put some pins in. So I'm going to draw some pins in here. And this is the first one you always do is the 90-degree pin. And there are these little triangles you'll find in your blade plate set. And you want the 90-degree pin to start with. You put the 90 in, and then you can use the angles on this little guide to put the rest of your pins in. Now this pin here is the one that I'm going to use to guide my saw blade for this particular cut right here. So I figured that this thing was at 70 degrees here based on my calculation. So I needed to be 20 off of this 90. This angle here is a 40. So if you bisect it with this pin, it'll give you this 20-degree angle, which will be that 70, if that makes sense to you. And then the next thing you're going to need is a pin for this cut here. And this one, we know, is 25 degrees off of this pin. So there's a 50-degree on that guide as well that you can use. And by bisecting it, it's going to give you this 25-degree angle, which is the size of your wedge. And then lastly, you're going to need a pin here that's going to guide your chisel. And that's going to be based on a goniometer measurement that you've done. So once you have these things in, all these pins, and your preoperative plan is essentially done at this point, the one final thing that you may want to do is make a couple measurements, how far down from the tip of the greater trochanter this chisel is going to go, and then possibly how big the lateral wedge is going to be. In this particular instance, it was 16 millimeters. Once you have all that done, this is the hard part, once you have all that done, it's a matter of executing the whole thing.